Welcome back to the program. Thank you so much for being with us this morning. So back in August, I've got this headline here. August 15th of this year, over at townhall.com, collusion is causing healthcare costs to soar. It's by a guy by the name of Andrew Langer. Also, we have, is it time to break up the big health insurance companies? This was back in September of this year. Again, a gentleman by the name of Andrew Langer, who is president of the Institute for Liberty. Andrew, you're on the line. How's it going this morning?
It's going great. Thank you for having me on.
Absolutely. I love the title of these articles. You know, I've asked these questions for a long time, and right now it seems like people are debating this policy of price controls and trying to, well, just in your words, what's going on right now with health insurance companies?
Well, I mean, it's fairly straightforward. I mean, there are two different ways to look at it, right? If you look back at the way our financial system tipped over in 2007 and 2008, we had these banks that were too big to fail. We enacted a bunch of reforms that were supposedly aimed at preventing this, and of course, those financial institutions became even too bigger to fail. The same thing happened in healthcare. The Affordable Care Act was supposed to, bring prices down for consumers, make healthcare more accessible. And instead, because essentially you had the big HMOs writing the legislation along with the Democrats, they saw it as much in the same way that socialism is the transitional phase between capitalism and communism. The circumstances we're in now are the transitional phase between a more market-oriented approach to healthcare and the eventual either single-payer system or out-and-out government takeover. And so the smaller health insurance, the smaller HMOs could not handle the mandates. So there was consolidation. There were folks who left the marketplaces.
Yep.
And we're left with these big HMOs that are essentially able to gin the process. And it all culminates right now in what is an important debate over how to deal with surprise medical billing, which we can get into. And you've got one side sort of talking about price controls, and we all know, if you know anything about a market system, anytime you impose price controls in a market-based environment, that's how you destroy the marketplace.
Yes, absolutely. And so what's the other option? I mean, because I'm a free market guy, I'm a limited government guy, but I also know that the government is so involved in our healthcare decisions, and it's actually worse than that. The line between the government and the private health insurance companies is so blurry. Here in my state of Arkansas, we expanded Medicaid, but we did it by giving $600 a month per person to Blue Cross and Blue Shield, regardless of whether or not they go to the doctor or not. And so at this point, I don't know what to do, because I don't really feel bad for the insurance companies if they get broken up, but I do kind of lament the fact that I am now looking to the government to try to come up with some solution when it was the government and the health insurance industry in the first place that created the problem. You know what I mean?
Well, yeah, I mean, let's start here with the surprise medical billing issue, which is the proximate issue. And it's this idea that if you go into a hospital for a procedure and somewhere along the way, it's sort of the chain of custody that you have, somebody out of your market somehow gets involved in it, and all of a sudden you're stuck with a bill of, several $1,000s. The government doesn't have to institute price controls to deal with that. I mean, essentially there can be a mandate moving forward that says, if everybody in a hospital system that is in the chain of a particular patient needs to accept that medical insurance, that patient's medical insurance, otherwise they can't be involved in all this. Or if there's some kind of an emergency, then the hospital has to eat the cost. That sort of institutes some kind of discipline here in the situation. On the other, and then with the other part of it, which is the existing surprise medical bills, then you submit it to arbitration and you have some kind of negotiation. That's one way to look at it. But more importantly and more generally, when we're talking about healthcare and healthcare reform, our politicians need to take a cue from the Hippocratic Oath and first, take the idea that first they should do no harm. Let's not harm the situation more than it already is. And it is, you're absolutely correct. We have thoroughly flummoxed this healthcare system to the point where there really is no actual marketplace. And then what we need to do is we need to start moving in the direction of getting rid of the mandates and regulations and red tape that prevent that marketplace from happening. And we need to essentially look at the environment in which if an actor in the marketplace is advocating for particular policies, they can't be using the power of government to create a competitive advantage, which is the very essence of cronyism.
Yeah.
And that's exactly what happened in the Affordable Care Act. You had the big HMOs writing the legislation, and they were taking on increased amounts of regulation because they knew that they could drive their smaller competitors out of the marketplace.
Yeah. Wow.
Yeah.
And then, not to mention, what do they do with all this money? They also give it to political action committees that are going to support the politicians that are going to continue to vote for their interests. And I mean, I've seen it right here. It's just amazing, how many people campaigned not to, for example, expand Medicaid, and then they did just that because it was so much money that was going to come in, and there were all this short-term thinking. Go ahead.
Here's the handy guide, real quick. Here's the handy guide that we use when we talk about money in politics. If someone is spending money in politics to advance policies that benefit everyone, that give everybody a shot, sort of level the playing field, that's money that's well spent. But if someone is spending money in politics because they know they're going to get something out of government at the other end, whether it is a competitive advantage or whether it is actual cash, right? So Blue Cross and Blue Shield getting $600 a month per patient, regardless of whether or not that patient goes to the doctor, that's a problem. That's the transactional nature of politics. And you and I both know the only way you can deal with that is by curtailing the power of government to give out those large sums of money to people. Yeah. That's the only way you deal with it.
Yeah, no, you're exactly right. We're talking with the president of the Institute for Liberty, Andrew Langer. He had this article in August, townhall.com, collusion is causing healthcare costs to soar. Let's talk about this other one, where you asked the question in September, is it time to break up the big health insurance companies? What say you, sir?
Well, I mean, this gets into, you and I are on the same page here. We're both loath to use the power of government to interfere in the marketplace and to break these companies up. But again, it's a situation, the issue of antitrust is very straightforward. It deals with the issue of cronies, and cronies are the folks who are going to use their power to expand the size of government to keep their competitors out of the marketplace. And once that happens, then we have to take a long, hard look at the situation. Now, of course, the problem is, if they are big enough to influence policy to keep their competitors out of the marketplace, then they're hugely big enough to keep themselves from getting broken up. And in that instance, then we really have to look at this. I mean, listen, as I said, I'm not someone who believes in the concept necessarily of too big to fail. We saw what happened in 2009, 2010, when the Obama administration came in and the CFPB was created, and it had the opposite impact of what it was intended. But nevertheless, right, we need to be looking and saying, if we want to have an actual marketplace, a competitive marketplace, that means more actors have to be in it. That means, removing the mandates that prevent the smaller actors from being able to participate. And then if it means breaking up the biggest actors so that they can't engage in that competitive advantage, then that's what it means.
One part of this equation we haven't talked about are the hospitals. Can you address their relationship with the insurance companies, and more specifically, the tale of the $100 aspirin? What their actual losses are versus what they report their losses are, and how that can affect this marketplace. Because at some point, they have this phrase, uncompensated care. I'm not saying uncompensated care doesn't exist. There's some level of uncollectibles in every business that you're in. But it's always what they cry to the government, you've got to do this to help us negate or pay us back for uncompensated care. But in my opinion, it's hospital math, and it's not accurate.
Well, some of it is hospital math and not accurate, but let's remember where we are in the marketplace, right, where we have the HMOs calling all the shots. And let's be really clear. You've got two things that are going on. And healthcare, we have to start with the proposition I'm sorry, we're going to do a little math here,
That's right.
or a little economics. That health insurance or healthcare is a resource economics problem, and you know, a widget is the amount of time or whatever service that a patient gets from a medical care provider. Now, the Affordable Care Act increased demand for that widget. And the problem is that we already had a declining supply of those widgets. So you have fewer people providing the care that it needs to be done in an environment of increasing demand. Now, when you have that kind of a situation, right, and remember, insurance in America is not really insurance at all in the truest sense. It's a cost-sharing mechanism like Costco. So if Costco starts running out of paper towels or toilet paper, they go to their supplier, they go to their distributors, and they get more of it. We can't do that with medical care because we have a finite number of medical schools. We have a finite number of residency programs, which is a whole other thing. So here's the problem. The only way you can control for costs in an era in which you have increased demand and declining supply is by lowering your reimbursement rates in terms of medical care. So the HMOs are paying less money for the same services, and this puts the squeeze on hospitals. Now, I'm not saying that hospitals are perfect, and I'm not saying that they don't overcharge for things as a result of trying to make up for these costs. But when you have sort of this idea that the only way you can control for costs in an era of declining supply and increasing demand is by driving down reimbursement rates, that's where you get some of this problem.
Wow. Yeah, that makes sense. That makes sense. Okay, so if we were to have some antitrust action here, breaking up these companies, do you think it would be easier on hospitals?
Well, I think it might be easier on hospitals, but let's be really clear here. And this sort of gets to the underlying issue really is that we do not have enough medical care to go around. And so part of the impetus behind breaking up the HMOs and pulling away from an HMO-centered model of health insurance is the fact that we don't have real free market competition. So, you know, we don't have real innovation. We don't have the driving down of cost that happens or the driving down of prices that happens. But the real issue here, and let's be very clear about it, is we have to find ways to produce more medical care in America. Now, that means more doctors. That means more nurses. That means more physicians' assistants. It also means that we have to do what we can to encourage hospitals to create residency programs. That's a whole other area in which the HMOs have managed to flummox things for hospitals because the reimbursement rates are different for residency programs. So they're not cost centers, they're cost takers away. But the reality is we need those training programs to create more doctors in America. So, you know, to me, we really missed the boat with the Affordable Care Act in that we not only did we not focus on how we go about solving this problem, we in fact exacerbated all of, listen, you want to use the phrase pre-existing conditions. The pre-existing liabilities in our medical care system in America were exacerbated by the Affordable Care Act. And so we need to be doing whatever we can to turn back that clock.
Andrew Langer, president of the Institute for Liberty. It's always great to talk to you, sir. Thank you so much.
Thanks, man. Look forward to coming back.
All righty. Yes, sir. Absolutely. You know, I'll tell you one thing about medical care, folks, in terms of we need to deliver more medical care. It's $600 a month per person going to insurance companies, regardless of whether or not there's any medical services actually delivered, is not part of the solution. I can tell you that much right now.